think. Welcome. Maybe you can start by telling me who you are and what you're doing here.
Sure. My name is Dr. Bill Crounse. I'm the Senior Director of Worldwide Health for the Microsoft Corporation out of Redmond, Washington in the Seattle area.
Okay, and you just did the...
I just did the opening keynote here at Games for Health Europe. I had the great pleasure of working with Ben Sawyer at Games for Health in Boston and providing the opening keynote there, and I guess it must have gone okay because they invited me to Europe to do this one. My role at Microsoft is working with our customers and partners around the world to show how Microsoft technologies can be used in health and healthcare. We have thousands and thousands of partners around the world who take a lot of our broad horizontal technologies and turn them into solutions for health and healthcare.
And you're a physician?
I'm a physician, actually a family physician by training. I practiced in the Seattle area for many years before my career kind of moved to all things technology. I became a CIO and CMIO of a big hospital and got involved in co-founding a couple of different technology companies, and about 11 years ago was invited to join Microsoft as it was forming its own healthcare vertical industry. And it's been a terrific ride, amazing advances, amazing changes in technology over that 11 years. And of course now there's so much excitement around our interactive entertainment business and gaming, and particularly the Kinect device, both for Xbox 360 and Windows. A lot of our partners and customers and researchers and scientists and physicians around the world are building really interesting applications and games for health and healthcare.
What was your story today? What was the point you wanted to make?
My story today was really to inspire the audience. That there are a lot of physicians and scientists and researchers and developers, game developers here, who are looking at how they can leverage that kind of technology and sort of gaming methodology to improve health and well-being. And my message is really, first of all, to show them sort of a potpourri of the things that are going on around the world, some of the successful companies that are starting up using some of our technologies like Kinect for Windows, for example, but also to ground them a little bit in terms of always considering not only the technology, but thinking through the business models for what they create. Sometimes I find that physicians, especially scientists, researchers, they get so caught up in sort of proving a point or proving out the research that even when they do that, they've forgotten about the business model that's needed to support it and scale it and take it forward. And you can create the most amazing technology, but if there isn't a real good business model around it, you think kind of follow the money and who pays and who wins and who loses, that's critically important if these things are going to have impact.
So that's a thing that's overlooked by a lot of
it. It is, and I remind them, they think that, well, I'm going to create a tremendous game that's going to help people with diabetes. And I'll sometimes challenge them. I say, well, that's a really noble thing to do. Who will buy your game? Well, the patients will buy the game. Well, I know from just being in this industry, being for a physician for so long, that when it comes to things related to chronic disease, by and large, patient education type vehicles, by and large, the consumer kind of resists plunking down their own money for that because they think that that's something their insurance company or government should pay for. Now, the corollary is that if it's a game that deals with fitness, beauty, weight loss, that kind of thing, making you more sexy, people will plunk down their money for that. But for diabetes or lung disease or some other kind of chronic condition, they really want somebody else to pay. So you really need to think through that business model if you're developing for that market and see, well, is it the insurance company that wins? Is it government that can win? Is there a way to save money in global budgets in healthcare? And you just need to follow the money.
Yeah, it's interesting that people aren't willing to pay for their own health.
Well, I wouldn't categorically say that they aren't, but by and large, again, both as a physician and what I've learned over my career, and in watching some other companies start up and fail because they didn't consider that very important metric of who pays and why.
So why are games for health important?
Well, I think it's important for a number of reasons. First of all, healthcare, the way we've historically done it for the past couple hundred years, one-on-one in an office, making the patient, get on the phone, make an appointment, wait a period of time, take time off work, drive somewhere, get 5 minutes with a doctor, drive to the pharmacy. That isn't very efficient, and it doesn't scale considering the kinds of technologies we have today that can be used. So whether it's more progressive use of messaging and mail to take care of little snippets of information that people might need, email I should have said, or whether it's video visits over the web for certain kinds of conditions or follow-ups, or whether it's doctors prescribing technology used in the home. It might be a Xbox 360 game or a Connect for Windows game, or it might be something on my smartphone that is programmatic in engaging me about monitoring my blood sugars or how I exercise or what I eat. Those are all really important technologies that can be used to kind of scale healthcare services. We talk a lot these days about what's called the triple aim. We've got to improve healthcare quality. We have to open more access to more people. Oh, and by the way, we have to do all that at lower cost.
Yeah.
Well, the only way you can do that is to start doing what we say new with less. So how do we do new things in healthcare with less money? And this is one way, is to use these consumer technologies and phones and things that everybody's got and everybody's using, and think of ways of how they play out in health and healthcare.
So is it mainly the costs that are important, or is it also that people?
I think a cost is certainly important. I mean, around and anywhere I travel in the developed world, whether we're spending 10 or 12% of GDP, or like we do in the U.S., 18% of GDP. Governments and citizens are very concerned about the spiraling costs, and eventually you're going to hit a wall where that cannot continue.
No.
So we've got to get smarter about how we sort of provision healthcare services and how we provision them, and even by whom. So the whole role of clinicians and the way we use nurses and other kinds of clinicians in healthcare is important too.
Yeah. What's your own personal favorite in this field?
Well, I'm really excited about some of the things I'm seeing that are going on with our Connect technology. Researchers and developers and game companies around the world are beginning to see healthcare as an important sector. I've been working with some companies that are doing interesting things. For example, one company focuses on helping surgeons or people who are working in the hospital and their hands aren't available, or they're scrubbed into surgery, using the Connect device to give them access to information on a screen like MRI or CT scans or other information about the patient as they operate without having to touch anything. That's important. Another company I've been working with is doing some really good work with physical medicine and rehabilitation, where the physiatist can basically prescribe their physical therapy, but then they can go home with a Connect device and a Windows interface, and they can actually do their physical therapy at home, and it can be monitored by the physical therapist remotely, and they can continually adjust the program to make it just right for the patient. That's real exciting. And then also just some of the things that insurance companies and others are coming up with that help people find resources, manage a disease, for example, diabetes, smartphones that can even actually take a blood sugar these days, record it, and send it up to a cloud-based service like our Microsoft Health Vault, for example, where that data is stored and aggregated and graphed, and it's very helpful to help people with diabetes manage their disease.
Yeah, but if you have to name one that you really love.
I don't think I could name one, and it would be unfair if I did, because there's so much good work going on all over the world.
Yeah. What's the most important trend that's going on at the moment?
Well, I think the trend is how we are using technology in healthcare. For too long, I think, first of all, the technology wasn't ready. Today, my favorite thing to tell people is we really have the technology to solve for almost anything in health and healthcare. What gets in the way now are cultures and behaviors and consumers and patients and regulations and rules and laws. But if we work with government, if we work with regulators, if we work with older clinicians, and certainly consumers have a real appetite for these new technologies and the way they can help them not only access health information, but also even certain kinds of medical services, I think it's tremendous. And we will help achieve that triple aim of higher quality, more access, lower cost.
Okay. I'm just looking over there. Oh,
Yes.
we have to...
I need to be somewhere else. So we'll do an edit here.
Yeah,
Just 1 second.
that's no problem.
Yeah.
Thank you very much.
Thank you. It's been a pleasure.
Okay.
I knew that.
Yeah, that's going to happen.